Big Sur is a rural community that is 30 miles south from the Monterey Peninsula, and our health center is the only health care for 100 miles of coastline.
So when the bridge went down, and it stayed down for 8 months, people on the other side of the bridge, on the south side of the bridge, were actually stranded because there were 2 more slides south of them. So they were literally on the Big Sur Island. And then the health center closed because we lost water, power, internet, and phones.
During that time, I was back home because I live in Monterey, and where I had perfectly good access to power, and I was able to use our electronic medical record through the cloud to access patient charts. I was able to advise them on medications or approve refills. I was able to provide medical care for people who otherwise there was nothing they could do.
During the time of the slides, being trapped within 2 slides, my father having had a stroke and having needed lots of medication to be delivered, was in a bind at that point.
Michelle called us and said, "I need help. My dad is going to be out of his medications and I don't know what to do."
So through the communication that we could have with various doctors within the health center, they were able to access my dad's files as well as what the medications he would be needing.
After I was able to make the arrangements with Specialized Aviation and we had a plan in place, being able to use the record and then check their medications to make sure they were getting the right one, they were refilling the correct one, and that they weren't prescribing anything new was critical.
So I think having the cloud-based EMR made a big difference, and otherwise I would have been sitting at home unable to do anything, feeling rather helpless.
We know that we can count on the health center. It is a lot of security for us.